Specific care issues is the third composite of the HHCAHPS on which LORIAN is measured and publicly reported on. As you meet with our patients to establish a plan of care and work with them on achieving their goals, medication, moving around safely, and pain should be ongoing topics of discussion. From your initial clinical assessment to the ongoing follow-up visits, in combination with the overall experience that you and everyone else in the team provides to every patient, their health and level of satisfaction will be impacted. You may wonder how these three topics are tied together within the HHCAHPS. Of the 19 questions that are used from the patient satisfaction survey to give LORIAN an official HHCAHPS score, 7 are from the specific care issues composite. Did someone talk with you about how to set up your home so you can move around safely? Has anyone from the agency talked to you about pain? And 5 questions on medication. Did someone talk to you about all the medicines you were taking? Did someone ask to see them? And did they talk to you about the purpose of each medication, when to take them, and the side effects? Why are these questions so important? Here are some things to consider. Patient adherence to taking their medications as ordered directly correlates with their understanding of their medications. Also, patients with multiple comorbidities and medications are more likely to be less compliant. And when patients adhere to taking their medications correctly, they have a lower rehospitalization rate. All clinical field staff play an important role in identifying when there is a need for medication reconciliation. Physical therapists, please order a nurse evaluation if a patient has 10 or more medications or 3 or more high-risk medications. If the patient has multiple comorbidities, if they are unable to name the purpose, directions for use, or the side effects of any of their medications. If they are non-compliant with taking medication, or if new medications are added and the patient does not know why. Remember that our registered dietitian is also available to assist patients with the following diagnoses: diabetes, congestive heart failure, hypertension, gastrostomy tubes, weight loss or failure to thrive, wounds, or labs. Before every start of care, resumption of care, or certification visit, please ask the patient to have their medications ready for your visit. All pill bottles, including supplements, inhalers, and eye drops, should be reviewed. It is in your best interest and that of the patient that you also review the medications on the HNP as well as on the discharge attachments. During the visit, please verify the medications by obtaining a copy of an accurate medication list and enter these into point care. Your documentation should also include IV medication, oxygen, nebulizers, and gastrostomy tubes. Remember to clarify any questions the patient or caregiver may have about the drug, dose, and/or frequency. When necessary, reconcile by contacting the MD regarding any medication concerns or interactions. We strongly encourage you to use SBAR for effective communication with MDs and to add a note of this in your narrative. Lastly, don't forget to add a clinical note as a follow-up when the MD office replies. All disciplines should be reviewing and discussing medications during every visit. Always take pride and give yourself credit for your work. Enter a medication profile reconciliation coordination note alongside your narrative note. Keep an eye out for and fix changes in dosing or frequency, new medications, medication understanding for nursing and at the start of care, resumption of care, recertification, and discharge, as well as for any non-adherence to taking medications. These should be entered as a quality issue medication error and reported to the MD. We are proud to have you on our team. Thank you for all you do.